I lost! How could I lose? I hate this country! How can a doctor do what they did to me, don't even lose their job? My life for the rest of my life. I am permanently disabled. I got burned alive for medication because of some stupid red legal tape. Justice was not served for Kalia.
Wow.
I deserved justice. I deserved to win. These people did not even do the bare minimum of their job. I can't do it no more, y'all. Like, I didn't been positive for 11 years.
That is way too long.
11 years! I hate this world.
That is a very shocking video, and unfortunately this does happen. So what you're seeing there is a woman who was not a victim of an arson attempt or a chemical burn accident. That was an adverse event from a medication. The medication was called Lamictal. Lamictal is a medication used to treat bipolar disorder and seizure disorder, and it carries a very real and very serious risk for something called Stevens-Johnson syndrome. Stevens-Johnson syndrome is like the boogeyman of the adverse event category. Every pharmacy student has heard of it. Every medical student has heard of it. It's very, very rare, but a lot of medications can actually cause it. SJS is essentially the worst rash you could ever imagine. It causes blisters to form on the skin all over the body, and then your skin basically falls off. And of course it leads to permanent scarring, sweat glands don't work anymore, you probably lose vision in your eye, which I believe happened to this young lady if I remember correctly, hair loss, and you're basically mutilated for the rest of your life. And yes, this can be fatal. I wouldn't wish SJS on my worst enemy. The risk for developing SJS when taking Lamictal is very difficult to convey in just one statistic. It's probably less than 1%, but certain factors can increase your risk. For most adults in most situations, it's far less than 1%. We're talking like 0.1%. But because this is so rare and there are things that can increase your risk for SJS, it really isn't something you can just hear one statistic and then feel comfortable predicting if it's going to happen or not. Things like age matter. Kiddos are more likely to get SJS than adults. Race matters. Asian Americans and African Americans have the highest rate of SJS in the country. Co-infections increase your risk, like HIV. So it's really, really difficult to get a thumb on how often this actually does happen, but just know that it's very, very rare. Also, as we'll see in this case, Lamictal is something that has to be titrated up very slowly, and moving too quickly in that titration can cause SJS. This woman was being treated for bipolar disorder, and according to her, she doesn't even have bipolar disorder. This was a wrong diagnosis. Now, bipolar disorder is very difficult to diagnose to begin with, so I don't know if you want to extend some sympathy for the practitioners involved or not, but it really isn't something that you can just draw a blood test and then, oh, you have bipolar disorder. In any event, she was diagnosed with bipolar disorder, and then a nurse practitioner prescribed Lamictal. The woman did not get any counseling about any rash or SJS or anything when it was initially prescribed. The first prescription she had filled at a pharmacy said this: Lamictal 25 milligram once a day for 1 week and 50 milligram once a day for 3 weeks. This is the second mistake. When we look at the prescribing information for Lamictal, it shows how this should be titrated, and what I just read there in most cases is taking up the dose way too quickly. Here you can see in this middle column, if the patient's not taking any other medications, for the first 2 weeks they take 25 milligram daily, and for week 3 and 4 they take 50 milligram daily, meaning that from the get-go, they were increasing this too quickly. Now, I do want to take a moment, because this is relevant, to look at the far right column here on this instruction. If they are taking other medications, you would start the dose at 50 milligram daily, and this would last for 2 weeks, and then you'd increase to 100 milligram daily. The reason why I bring this up is because sometimes pharmacies don't have the whole picture. And sometimes practitioners don't. If you go to multiple doctors, there is no universal EMR in the United States. And I have been saying for years that in the United States, I wish we had a universal EMR, so all the pharmacies and all the doctors were looking at the same information. But the court case I looked at didn't mention any of these other medications, so I'm assuming the middle column is what it should have been, and everyone agreed. This is very important because proper medication use is very patient-specific at times. And it takes a professional, a skilled clinician, several in fact at times, to be communicating correctly, and to devise a plan that is appropriate for you. What's right for one person is not right for another. Back to the story, the woman picked up the prescription from the pharmacy and received no counseling from the pharmacy either. At the advice of the nurse practitioner, 18 days later after picking up that first prescription, so we're talking like at week 2.5-ish, the nurse practitioner advised them to increase the dose to 100 milligram daily, and they just used the pills that they got from the first prescription to do this. In other words, the pharmacy had no idea that this increase had been made. Again, looking at the prescribing information, this is way too soon. You shouldn't be at a 100 milligram dose until week 5. 24 days after starting the therapy, a second prescription was sent to the pharmacy for 100 milligram per day. According to the manufacturer, this would be 4 days too soon, and now the pharmacy does know that they're on the 100 milligram dose. The pharmacy did not say anything to anyone. 5 days after this second prescription, the woman was in an intensive care unit fighting for her life because after feeling like she had a cold for a little bit, her skin started to fall off. She had to undergo multiple surgeries and is permanently scarred for the rest of her life. Obviously, this is very sad, and unless you have something severely wrong with you, your heart goes out to this woman. It was a horrible, horrible experience for anyone to endure. But what a lot of people are wondering, and myself as well, is who is at fault here? It could be the nurse practitioner for making the wrong diagnosis and prescribing the wrong dose. Or is it the pharmacy for not verifying the dose and not counseling the patient? The courts have spoken, and I'm going to look into the court case here today. Before I get into this, the reaction you saw of this woman in the beginning of the video was from a separate court case, the big court case, if you will. Evidently, the Supreme Court wouldn't hear her case against the nurse practitioner. The one we're looking at today, she did win, at least that's what I'm able to see from these court documents, and this was against the pharmacist. The defendant had 2 experts of her own choosing, evidently, testify in court, and one of them was a medical doctor, and this is what they said. It was his opinion to a reasonable degree of medical probability that the incorrect titration of Lamictal caused Stevens-Johnson syndrome and the life-threatening rash and was completely avoidable. This is not true. Stevens-Johnson syndrome can happen even if the directions are followed perfectly. For accurate medical information, I use Crush Cost, which is my company, and it lists all the warnings and all the adverse events provided by the manufacturers. So this is what the manufacturer has to say about this. There are suggestions yet to be proven that the risk of severe, potentially life-threatening rash may be increased by, and if we skip to number 3 here, exceeding the recommended dose escalation for Lamictal. However, cases have occurred in the absence of these factors. I was shocked whenever I read this because this is an expert medical testimony that is not accurate. And now I'm wondering how many other court cases out there have been ruled and found judgment with wrong information. There was also an expert pharmacist that testified, and this is what they said. The expert pharmacist said, if the manufacturer's guidelines are followed, there's virtually no chance you're going to have a problem. I like that a little bit better because he said virtually, but just a reminder, SJS can happen even if the directions are followed perfectly. The pharmacist should have called the prescriber and explained the problem. That would have avoided the entire situation. If the pharmacist had called the prescriber and she did not change the prescription, the pharmacist should have called the supervising physician to let her know about the problem. Again, this was an expert pharmacist appointed by the defendant. I don't know what they're talking about there because I've never in my life ever heard of a pharmacist going over a nurse practitioner's head to talk to their supervising physician. If any pharmacist is watching this and you know of this happening, do let me know in the comments. I'm just one person and I can only talk on my experience, but as far as I know, that never happens. The expert pharmacist goes on to say, if the supervising physician wanted the prescription filled as written, the pharmacist should have refused to fill it. I am so sick of people saying that pharmacists should just put pills in the bottle. We all wish that is all we had to do. Could you imagine how easy this job would be? So although everybody wants pharmacists to just put pills in the bottle, this unfortunately is a legal precedent set by our courts. According to that expert pharmacist, even calling the prescriber isn't enough. They should have refused to fill it. And in this case against the pharmacist, the trial court entered judgment against the pharmacist for the amount of $806,190.06. So when folks say pharmacists should just put the pills in the bottle, I really recommend they have at least $800,000 laying around and a new suit of skin for this young woman. Now, again, this is just the trial against the pharmacist. She did lose, or I guess put more accurately from what I understand, the Supreme Court would not hear her case against the nurse practitioner. So as far as I know, nothing happened to the nurse practitioner. There's a couple of things that I don't really understand about this case. Why didn't the pharmacist have their own expert testimony? I guess they just kind of laid down and took it. I don't know. So do you agree with this case? Should the pharmacist be held liable for $800,000? This is my opinion on this, and I don't feel too passionate about this because this is a very difficult situation, and it's very delicate. Quite frankly, she had something very horrible happen to her, so someone should have to pay, right? I think so. But in the case of the pharmacist, is it reasonable for us to warn somebody of every single adverse event? Obviously not. I think there's like 20,000 active drugs in the United States right now. Each of them have a laundry list. I mean, it'd be a number that no one could ever possibly ever remember. I mean, we would just sit there and read the little leaflet to them, I guess, like a story time or something. Another point that I don't know about is, did she refuse counseling by the pharmacy? It doesn't say in the court case. It's almost kind of like you have to hedge your bets. If you're a pharmacist, you have to pick the adverse events that are worth mentioning and ignore the other 100,000. It's almost like a game of chance if you're a pharmacist. You have to somehow use your crystal ball to see which adverse events are most important to warn them about. And of course, we're skilled professionals, so we have a pretty good idea of that, but we don't know what's going to happen. Additionally, I saw outside the court case, the pharmacist didn't say anything because they didn't want to scare the patient. And I know that sounds ridiculous, but I have heard from one of my colleagues that there have been at least one instance where a physician called a pharmacy and told the pharmacy not to tell the patient about the side effects because they wanted the patient to take it and they didn't want them to get scared. From my personal feeling, I think it could be reasonable to withhold information in some instances, but there is absolutely no way you could figure out which instances are worthy of doing that. So I don't recommend doing that. I think everybody should be informed. The risk of over-informing is not better than under-informing somebody. But I just do want to make a point. I mean, that is a logical thing to think at times. Additionally, I've made shorts of this court case, and a lot of the comments are people who are taking Lamictal who don't want to take it anymore because they saw the side effect. How is that in someone's best interest? It might be, it might not. It's very difficult to say. Obviously, these experts that took the throne and talked about the medicine, they were very obviously throwing the pharmacist under the bus, and they didn't really care. I didn't know that you could pay someone to do that. I'm guessing that's what happened here. In any event, both prescriptions were wrong. The pharmacist could have taken the time to talk to the patient and see if they were on any other medications that would justify a different dose than the one they had received on the prescription, and they didn't do that. But then again, how often do people actually even know what the medications are they're taking? It's such a difficult situation. There are some folks who wouldn't know if they were taking any other medications or which ones those were. And if the pharmacy couldn't get an answer, should they just stop the prescription and not let them have their meds? How well do you think that would go over in most cases? But, take a look at what happened here. You would have been saving somebody's rest of their life, really. And while we're on the topic of the incorrect dose titration, I am so sick of providers getting creative with these prescriptions. I see it all the time. Eliquis is another one. For whatever reason, there are way too many people who think that they can just dose Eliquis once a day. That is a twice-a-day medication in all instances. And in the case of this, I guess they were like, well, it needs titrated. How do you titrate it? I don't know. This should be good. The information's out there. And given that there are 20,000 medications in the United States, is it reasonable even for a pharmacist to have all of them memorized? Obviously not. But in this case with Lamictal, this is a test question. Probably every medical student has a question about Lamictal and Stevens-Johnson syndrome. Every pharmacy student does. To pass your boards, you will have a question about this. This is very, very well known. So much so that there's something called a boxed warning in the prescribing information, and it talks about the risk for Stevens-Johnson syndrome. So this is a little bit different than your average, ordinary, run-of-the-mill medication. This is the thing. So to be concise here, I have a little bit of empathy for the pharmacist, seeing that there was some titration happening, and they didn't take the time to verify that it was correct. How far do you have to deviate from what's printed in the prescribing information for it to become a problem? In this case, that you better follow it correctly or else people are going to come after you. What I really don't like is that nobody, including the pharmacy, talked to the patient about this. That right there feels like the biggest error to me on behalf of the pharmacy. So $800,000, I mean, that's a life-ruining amount of money. I would assume she had insurance. I don't know. But I would, in my opinion, I think probably a more reasonable actual amount of money that they could really theoretically pay back would be more appropriate for not counseling. But what I think doesn't matter. Now every pharmacist that sees this is going to take a lot of time verifying Lamictal prescriptions from here on out. I can pretty much guarantee it. But what's the point of even calling the prescriber? The expert pharmacist said they should have declined to fill it anyway, so I guess decline first and then ask questions later in the case like this. And by the way, if you're wondering why she didn't sue the manufacturer of Lamictal, it's because they can't be sued. As long as they're submitting information to the FDA to get approval in good faith, it would be unreasonable for anyone to bring a medication to market. All medications have risks. It depends on the skilled clinicians to determine if the benefits outweigh those risks. The analogy I get sometimes is a car. We could make a car that would never, ever cause any death in the United States, but it would cost too much and nobody could buy it. So you do assume some risk with some activities, and prescribing medication is one of them. After reading through this case and understanding it to the best of my ability, I mean, these are my takeaways. 1, Lamictal is not something to mess around with. You better have your I's dotted and your T's crossed in everything you do with it. And 2, if you're a pharmacist, you could be held liable, even if the doctor says it's okay.